So, yeah, okay. Good afternoon, everyone. Yeah, Suzanne said, I'm a health psychologist. I work in Belfast currently, based in Queen's University in Belfast. And I want to tell you a little bit about what health psychology is and how you can become a health psychologist. So you'll see some similarities to some of the presentations that you've already heard today, but some differences too. So health psychology, what is it, is a good place to start, I think. And so health psychology is the application of psychological theory, methods and research to health, physical illness and healthcare. Okay, so that's the formal definition, but another way of thinking about that is to say that it's how we can use psychology in the area of physical illness. Okay, so how we can use psychology in the area of physical illness. That's what health psychology is all about. That's what its focus is. Its focus is on physical illness. So unlike other areas of psychology, clinical, for example, where the main focus is on mental ill health, health psychology's focus is on physical ill health. And we can break down what health psychologists do into two broad areas. So we're interested in stopping people becoming ill, physically ill, firstly, and that is the area of health promotion or health maintenance, if you like. So encouraging people to look after themselves, to stop getting ill in the first place, which is the ideal, of course. But then knowing that that doesn't always work and that some people will develop physical illnesses, we are also interested in the effects of those illnesses and again, what psychology can do to help people in that situation. And there are two things, I suppose, two broad things that psychology can do in terms of the consequences of physical illness. One is helping people to make changes to their lifestyle that will help them adjust to the illness. And the other one is thinking about and helping people with the psychological distress and the other psychological consequences that result from a physical illness, especially from a long-term illness. So you can think of what those things might be, like anxiety and depression and stress and other things that people experience whenever they have been diagnosed and have to live with a long-term condition. And we look at both of those things, both the adjustments to lifestyle and also the psychological consequences, the mental health consequences, if you like, because you can't separate the two. So you can't look at one without the other. The saying goes, there's no physical health without mental health. So you can't separate the two. So anyone who's working in this area of health care has to pay attention to all aspects of the consequences on that person's life. But anyway, those are the two broad areas that to help convey what health psychologists do. Hopefully, those are the two broad areas that we work in. So the first one is focused primarily on health behavior change. It's helping people to modify those behaviors that will have an impact on your health for the purposes of, as I said, stopping you becoming ill in the first place. So what sort of behaviors are we talking about there? Well, it'll be no surprise to you to know that we're talking about things like drinking. And so health psychologists might spend some time doing interventions to help people reduce the amount of drink they're consuming. So these are public health interventions I'm talking about. These are, this is not specific to one group of people. This is a general message that we would work with public health teams to produce general messages for the general public to help people change their behavior. So you'll see that drinking, reducing your alcohol campaigns across the country from time to time. And they may have some health psychology input. If they're any good, they'll have some health psychology input. The reason why they're not good sometimes because they haven't bothered talking to a health psychologist. But of course, when we're involved, it'll be much better. So that might be something. So drinking, obviously, exercise, trying to promote exercise, um, something else that, there's a public health message that you'll see, and diet. So those are the three big ones that you'll undoubtedly think about straight away whenever someone talks about health behavior change. You'll think about alcohol consumption, exercise, diet. You'll probably think about smoking cessation as well. There are other more subtle behaviors that we can think about, things like, toothbrushing, looking after your teeth is a health promotion behavior. Going to the doctor is whenever you're not feeling well. Going to your GP is a health promotion behavior. Taking medication when you're supposed to take it in the right doses that you've been prescribed is a health promotion behavior. Attending a screening appointment is a health promotion behavior. So all of those things are also of interest to health psychologists, and health psychologists will develop interventions to encourage, facilitate people engaging in those behaviors where they want to, of course. Now, you might think those interventions should be fairly straightforward. Surely it's just a matter of telling people about the benefits of all of these behaviors, and they will engage in them. But that's not the way to do it. That's not knowledge, information, education is not sufficient for behavior change, as we know. And that's where the health psychology models that we use come in to help us understand, well, what are the factors beyond knowledge, beyond information? What are the factors that we need to tap into that help people to make these behavior changes? So in the face of it, they seem like a fairly straightforward thing to change, but they're very complex, actually, and there are a lot of complex factors at play. And if you've ever tried to change any of these behaviors, you'll know yourself that it's not as easy as it first appears. I like to show this little example here as a clear indication of how knowledge has no impact on behavior. This is an advertisement for a chain of restaurants in America. They're called Heart Attack Grills. So you can see the fact that we know that eating a bad diet is bad for us, it's bad for our health, doesn't mean we won't do it. And in fact, this chain of restaurants plays on the very notion that, it's almost good fun to put your health at risk by eating bad diet, although the burgers look good. So anyway, you can see it's a more complex behavior than just telling people what's bad for them, because in some cases that actually encourages this sort of behavior. So those are the sorts of things we're thinking about when we're thinking about health promotion. Okay, that's one part of what health psychologists do. But health psychology is also important. It's not just about promotion and maintenance of health and well-being. It's also important to think about whenever we have become ill. As I said, that's the second part, the second element of health psychology. So when people become ill, what can we think about there that might help? So you can see some examples there of, if people have been diagnosed with heart disease, we might think of interventions to manage their stress. We also need to think of lifestyle changes. And diabetes, we need to think of lifestyle changes and adherence to medication regimes, and so on. So there are often psychological concerns, psychological factors at play in adjustment to illness. And heart disease and diabetes are two of the biggest, most prevalent illnesses in the country. So, they have a major psychological component, and so there's lots of work for health psychologists to do. Just to give you some examples of that here, you can see this is recommendations for content of cardiac rehabilitation. And you may notice that health behavior change and lifestyle risk factor management and psychosocial health are some of the key elements of cardiac rehabilitation. So the sorts of things that health psychologists are interested in, the sorts of areas that they work in, are key elements of the rehabilitation of people who have been diagnosed with heart disease. You can see again here promoting exercise among people with diabetes. Again, that's good work for health psychologists to try and encourage people to manage their lifestyle. They may have to change their dietary behavior, change their exercise behavior, as I said before, manage adherence to their medication and so on. So again, lots of work there for health psychologists to do. So the way we do that work can be one-to-one or group work in clinical settings. You might have groups in hospitals or meeting patients one-to-one in hospitals. Health psychologists will also make contributions to strategic development of healthcare policy. We'll do health promotion work in the community, as I mentioned near the start of this presentation. But we also train other health professionals. Quite a lot of the work that health psychologists do, it focuses on training other health professionals, people who are already managing and helping people with heart disease, diabetes, and so on. It's helping them to have conversations with their patients in a more helpful way, in a more psychologically informed manner that might help have better outcomes for the patients. So we do spend a lot of our time training others. Okay, so if that's the sort of thing that interests you, how do you become a health psychologist? Well, you'll need to have an accredited degree in psychology, and then you complete a period of, postgraduate training of at least 3 years. I said then you do that, but actually I'll show you in a second how you don't have to do it in that order. But anyway, ultimately you need to have an accredited undergraduate program and 3 years postgraduate training. In the UK, health psychologists are regulated by the Health and Care Professions Council, so you need to do training that's been approved by that body, that Health and Care Professions Council. And of course, you have the divisions of health psychology in both the BPS and the PSA accrediting the courses. So to becoming a health psychologist, it's broken down into 2 stages. So much like sport and exercise psychology, you do stage 1 MSc, which certifies that you have the appropriate academic knowledge base for health psychology. And then you do a stage 2 training, which is at least 2 years supervised practice, and that includes the following areas of competence. So you need to demonstrate competence as working just as a generic autonomous professional. You need to demonstrate competence in research, in consultancy, in teaching and training, because I say training is an important part of what we do, training other health professionals, and in the delivery of psychological interventions. Now, in most cases, well, in a lot of cases, you need to have your accredited undergraduate degree before you do the stage 1 MSc. But some universities will allow you to take the stage 1 MSc in health psychology before you have your accredited degree. So you can do the stage 1 MSc, and then you can go back and do your accredited, maybe another master's conversion course or something like that, if you haven't got an accredited psychology degree to start with. So it depends on the university that's offering the MSc whether they allow you to do that. But from the perspective of qualifying as a health psychologist, it doesn't matter whether you do your MSc first or your accredited degree first, but you will need both before you can get onto the stage 2 qualification. Okay, so where might you do the MSc in health psychology? Well, there are a number of courses in England, Scotland, and Wales, and you can see those. I've given the link there. So there's a lot of them. There's 31 currently accredited courses, so I haven't listed them all, but you can, if you follow that link, it'll show you where they all are. There are lots of them. So basically, wherever you want to do an MSc, there's likely to be a health psychology course there. In Ireland, we have a distance learning course in Ulster University. So that's distance learning. So that might appeal to lots of people. And we have a course in NUI Galway. So that's where you'll do the MSCs. And then once you've got that, you can move on to stage 2 courses. And in GB, there are stage 2 courses again in England and Scotland. So you can see the list of them there. And there's a stage 2, the structured PhD stage 2 course in NUI Galway. And then the other thing to mention is that you can do your stage 2 qualification through an independent route offered by the BPS. So basically, this is where you find your own supervisor, and between you and your supervisor, you develop your own plan of training, and you submit that to the BPS, and they will approve the plan of training, so that you know if you follow that plan of training, it will meet the qualification. And then you submit a portfolio of work at the end of that, and you attend for a Viva examination, and if all of that goes well, then that will give you your stage 2 qualification. It doesn't give you a doctoral qualification, it's doctoral level, but because BPS isn't a university, they can't award you a doctorate, even though it's the same qualification. But if you want to work as a health psychologist, it's treated exactly the same. So that's a possibility for people who want a little bit of flexibility. You have to pay the supervisor, that's where the fees come in, and you have to pay the BPS for, there's some fees to pay them for administration costs and so on, and examination fees, etc. So those are the possibilities in terms of qualifying across the stage 1 and stage 2. Money, of course, is important. If you go to work in the NHS, so Scotland is well advanced in health psychology training compared to the rest of us, and Scotland has a 2-year paid trainee course. So you can do your stage 2 qualification in Scotland. You can be paid to do that stage 2 qualification, and you will be employed by NHS Scotland during your time. So that's competitive application, obviously. And the training salary for that is 31,800 currently £. So that's the starting point in the NHS. Of course, there are health psychologists who work in universities, because a lot of what we do can be university based. So you can see the salary range there. Just to note that there are very few people get anywhere near the top end of that range. So don't expect, look down the lower end of the range if you want to get a more realistic salary. Okay, so that's a summary of how you get to be a health psychologist. You got your undergraduate qualification, your MSc, and then you either do your an accredited doctoral program in the university, or through the BPS you can do the independent route. And I've put some links on there for the 2 divisions, the BPS and the PSI. Okay, Suzanne, that's me. Thanks very much, everyone.
Martin, that's brilliant. Thank you so much on behalf of the audience. We do have a couple of minutes for questions and answers, so I'll have a quick look. One of the questions, Martin, is, does health psychology generate most of its own research material on behavioural change, or does it borrow from other disciplines, or is it a mixture of the two?
I would say it generates most of its own research. So a lot of health psychologists, a lot of the early health psychologists certainly tended to be more academic than practicing. And so there's a very rich body of literature in health psychology, looking at behavior change models and so on. That's not to say that we ignore other research. So I mean, social psychology contributes quite a bit to our understanding of behavior too. So that's important. Cognitive psychology is important too, because cognitions are an important predictor of behavior. And they're public health medicine. We work very closely with in terms of health promotion. And they have frameworks that they use that are very useful for the type of work that we do. So I think we generate a lot of our own. Probably most of the work that we do is based on the research that health psychologists themselves have generated, but we also borrow.
Okay. And Martin, you may have answered this in your presentation, but there's just a couple of questions asking about the health psychology MSc in Queen's and how it links into the accreditation training pathways that you've mentioned.
So the one in Queen's is an MSc in clinical health psychology. If that's the one that the questioner is talking about, that's the only MSc in Queen's that sounds like health psychology is the MSc in clinical health psychology, and it's not accredited. It's not meant to be accredited. It's a different type of MSc. It's not pure health psychology. It's both clinical and health psychology. So so it wouldn't help you if you wanted to be a health psych. Well, it would help you in terms of there's some useful information, but it will not get you along the professional pathway of accreditation.
Okay.
If you do that MS.
And that's probably useful information for all of our attendees, that there are courses out there that are not accredited, but they're not designed to be accredited. They're designed to be postgraduate skills-based programs, developing research, understanding, applied psychology knowledge, and just them not being accredited doesn't mean that they're not able to be accredited. There just isn't a structure within which to do it. Okay. I'm conscious of time, so Martin, if you're happy to answer a couple of if there's any more questions on the Q&A specific to health, that would be brilliant. But for the moment, I might thank you again on behalf of the audience that are here for your presentation.
Thank you.